All our work is talking and greeting. First greeting, salam, then the subject we will be discussing that week in the instruction room. And after that, we demonstrate the subject. Our work, the work of the Murshidat, is important with respect to hygiene. Don't let your house be dirty. Your house should be clean.
Just as these little girls are learning to tidy their houses, many of their grown-up counterparts are becoming primary movers in cleaning up problems that until now have prevented effective healthcare delivery in their community. At the same time, they are breaking down long-standing barriers to social relations and affecting positive change.
والتغييرات الإيجابية الفعالة. هذه هي مدينة عبس في المنطقة الساحلية لليمن.
This is the town of Aps in the coastal region of Yemen. In the early 1980s, Aps, located in what was then officially known as the Yemen Arab Republic, or North Yemen, had a government healthcare facility which was considerably underused. Despite the best efforts of an international team of doctors, nurses, midwives, social workers, and even anthropologists, babies born at home under unsanitary conditions were dying routinely of dehydration, and mothers were barely surviving the severest forms of anemia.
Women, when they used to give birth, they would wait at home 2-3 days. She might hemorrhage or have any kind of complication. Nobody would help her. If she got sick during labor, they might take her to Hudaydah or any place else. Furthermore, in the markas, since people didn't know any better, they would see a man's face and go back, saying, "I won't see a man." Sometimes she would give birth in the car on the way to Hudaydah. Sometimes she would give birth in Hudaydah itself.
Yemen is the fastest growing Arab country, with a population of 14.5 million in 1994 and over 17 million in 1998. At this rate, the development of adequate health services can't be expected to meet the demand in the near future. Yemen has a high growth rate, coupled with high rates of fertility and infant and maternal mortality. Life expectancy, levels of literacy, and per capita GNP for Yemenis also remain low. In the rural areas where 80% of Yemenis still reside, sanitation and knowledge of basic hygiene are limited or virtually non-existent. Most Yemenis who live in hamlets and villages scattered throughout a varied terrain lack ready access to disease supervision and health monitoring systems. This, coupled with a general lack of health education, has caused a high incidence of death among infants and children. In 1985, the Yemeni government, with British, Canadian, and United States support, expanded the existing healthcare facility by building the Maternal and Child Health Center. Britain's International Cooperation for Development then sponsored the training of both women and men as primary healthcare workers.
It was hard for us at the beginning. People talked about us in a bad way. They said bad words about us because we were going to the hospital and being with men. Little by little, after the people began to benefit, they began to bring the pregnant women. We advised the mother. We see her on the 4th month. We tell her to come every month. When we examine her, we give her pills. We used to have iron pills. We vaccinate her. They asked us, and when they saw that we had expertise, some of us, for example, Managia and I, have training as midwives. The other women, we encouraged them, and we told them if they studied like us, that they could benefit our community. One of the British, I think she is American, yes, American, would tell them, you would benefit from this training. It would bring you salary, you would be employed. We were not interested in the money or that we would get a position. The important thing was that we would learn.
The once dormant health care facility of the 1980s has become a bustling center of activity in the 1990s. An entire community, including members from all social groups, is now seeking the health care of its families.
When we trained, each of us had to do 20 deliveries. A Sudanese trainer, Hafsa, supervised us. At first, women said they wanted the American or the British to deliver their babies. Then the British women would say that Fatima or Managia have to come with me. The teacher or the American would sit and watch us while we would do the delivery or immunization or medication. Little by little, instead of going to her, they used to say she doesn't understand our language. Let's get Fatima or Munagia. We met in the women's homes every Thursday morning. In the afternoons and evenings, Munagia and I would go to a wedding or a mourning or other occasion and tell people about our training. The women started to come to us to ask for advice. When the women came saying they had a pain or were pregnant, we told them we could help them if they would come to the hospital. They came to the hospital and we did the examination, and when a woman returned to her house and the other women, she talked about what she got at the markas. These women would say what good girls we were, that we helped them and gave them vitamin tablets. And at that time, it was a big thing.
My name is Delores Walters. I am known to many Yemenis as Dr. Delores. I was conducting field research for a doctorate in anthropology in APS between 1983 and 84, when I observed that the residents of APS were not using the local health facility, despite the determined efforts of an international health team led by the British. 10 years later, in 1994, when I returned to APS to conduct postdoctoral studies, I found a bustling center for women and children, which had become a prominent feature of the health facility. The remarkable change that I have been observing is the result of the training of primary health care workers known as Murshidat, or more accurately, Murshidat el-Sahiyat. Because of their dedication and outreach in their community, standards of health care have been raised in both villages and cities. In addition, members of all social classes, including the most marginal, are being trained as healthcare workers and also receiving health care. In the early 1980s, no girls attended school in the rural districts of APS, and relatively few went to school in the town itself. Hind was the first woman in APS to complete her high school certificate in the mid-1980s. She worked as a registrar at the center before being trained as a Murshidat. The changes that are occurring in the healthcare system are changing the lives of women in general. I have known Mona since 1983, prior to her Murshidat training. At that time, she supplemented the family income by making traditional dresses at home with her sisters.
We graduated in 1991. True, I was poor. I am divorced and I have a child and need the money. But sometimes a woman is bleeding, for example in my house. My sister, when she had her baby, her placenta came before the baby. We took her to Hudaida on an emergency basis. I went to the people even if they called me after midnight. I tell you, it is good to help the people. In the past, we had no hospital. If there was difficulty with delivery or bleeding, they took her to the hospital in Hudaida. But now, praise God, there is the markaz. They can call us from our houses if there's bleeding or delivery of the placenta, or they can take their wives to the center, and the one who is on duty will do everything for them.
تدفق سيل من المغتربين من الأسر العاملة التي كانت تسكن في السعودية وبقية
During the Gulf War, a huge influx of migrant labor families who had been living in Saudi Arabia and other Gulf countries returned to Yemen. The younger migrants include several women who have become Murshidat. Because male members of these families have often been unable to find steady work, in many cases the Murshidat support entire families.
Because we are always there, we are standing by them. They call me any time and we go. The benefit for me is my salary for myself, my son, even my brothers.
The 20 Murshidat run the Maternal and Child Health Center. They provide wellness and preventive health services to mothers and children, including pre- and postnatal care, routine deliveries, well baby examinations, immunizations, treatment of common ailments, and counseling and dispensing of family planning methods. Typical treatment on an average day might include 30 to 50 immunizations given to children and mothers for tetanus. In addition, 20 to 25 women and children may be treated for malaria, usually by intravenous or intramuscular injection, and babies are delivered by the Murshidat throughout the day. It is not uncommon for as many as 3 babies to be born on the night shift.
I was born and grew up in Saudi Arabia. I returned during the Gulf crisis and I had a 6th grade education and had started the first year of middle school. As a child, I used to pretend to give injections to my brother and sister using a stick. When I came here, I heard about the training for Murshidat, so I did my best to be registered in it. Thank God I registered in it, completed and passed with an excellent grade. After that, we went to Hajjah to get appointed. I started my work. My family understood from the beginning. I went to the hospital to be trained. I had a daughter, and I had a husband, and my husband was mentally ill. I was poor, and I was looking for any job to earn money. Today, thank God, I am taking care of myself and my daughter.
The Murshidat are making the transition from work in the informal sector to work as salaried professionals. In the process, they are changing their roles, perceptions, and identities as Muslim women.
Before, I was like any girl who doesn't understand anything. Now I understand a lot. I understand everything. For example, I understand health and hygiene better than I did before. Before, I didn't understand. The role of women is important. She can know how to take care of her children in a healthy way. She can share with her brother on an equal basis in the labor force. And she can spend on herself. In the past, she did not have any say if they spent money on her or not. Now, thanks to God, she can spend on herself and her family like a man.
In the early 1980s, there were few respectable options for working women in Yemen. One was making the colorful traditional dresses which Absi women wore every day. Today, due to increasingly conservative Muslim influences in the society, women who work outside of the home or who go to school wear the all-black balto, even in this sweltering climate.
من أول كان نفس المرشدات مثلا لابسين الزي الرسمي.
Before, some of them wore a uniform, and some of them wore their dresses, and you could not distinguish between the patient and the Murshidat. Now, all of them wear the white balto so that you can distinguish them from the patient. Before, they didn't veil because the population was small. Everyone knew each other, and they were shy to say bad things about each other. And now the population has increased, especially after the Gulf War. Those people living in Saudi Arabia used to cover their faces, so they come back covering their faces. Older women do not cover their faces, only the young girls.
While the return of migrants from Saudi Arabia and other Gulf states has increased the demand for more adequate health care and other services, credit for the transition must go to the Murshidat. These women, who have acquired at least a 6th grade education, participate in a 1-year training program where they learn basic hygiene, nutrition, and physiology and anatomy. Since 1986, 4 classes, all trained by certified Sudanese midwives, have become Murshidat. Fatima Blue was in the first group of trainees and is one of the 20 women dedicated to empowering both themselves and the community. In her 20s, she is married to one of the health center's interns and has an infant son. Managia is a widow in her late 20s. She was married at age 14 and gave birth at age 15, but her husband was accidentally killed, and her young son died of an unknown illness. At 16, she was also in the first class of Murshidat trainees in 1985. Now, more than 10 years later, Managia is the Murshidat supervisor.
والآن وبعد أكثر من مرور 10 سنوات مناجية هي مشرفة المرشدات.
I am supervising everything, cleaning for example, midwifery and what is needed, family planning, what they need in it, vaccination, nutrition, instruction. I see what they need in each one and write to regional asking for it from the administration. I follow up so that the work does not decline. I benefit myself with more skills and learning. I have more confidence. Now that I have more responsibility in my job, my mind is more open. Education has changed our way of raising our children and many other things. For myself, my life in my house and my food was not healthy. I used to spend my whole day with a sandwich and soft drink. You see how fat I am? I used to be dependent on starches because I like them a lot. Now I eat a greater variety of foods because it benefits my health, blood, energy, and everything. My life has changed since I became a Murshidat. I know how to take care of my children. We have a schedule. Each day we have something. One day is breastfeeding, one day about vaccination, one day about cleanliness, one day about diarrhea. For example, today our subject is breastfeeding. I greet her and ask her about her children, so that she feels I am very friendly and not distant from her. I do not sit like I am sitting now on a chair. If I stood with a ruler in my hand and said, "Look at this and this," the mothers would think I am lecturing them, not giving advice and instructions. I sit with them at this level. for example, if they come 4 or 5 together, and I pick up the picture and sit with them. I don't leave the picture hanging and tell her such and such and such. She wouldn't understand anything.
واجلس عندها مش اعلق كم صوره هنا واقول لها شوف اليوم كذا وكذا وكذا ما تفهم ولا حاجه. مثلا في اشياء صعوبه تواجهنا كثيره.
We have many problems with the mothers. One of the problems is family planning. Some of the mothers don't know how to use the method, even though we explain it. Some say it is against our religion. We explain to them that family planning is not against our religion, but it is against our religion only if you stop having children forever. What is against the religion is having a child yearly, one child after another. She will not be in good health and she cannot take care of her children. The father cannot support his children because his salary is not enough. There needs to be spacing so that she can teach her children and the children can go to school. The mother must be in good health so that she can clean her house and take care of her children. Sometimes a man accepts this talk. Sometimes he refuses and says it's in the hands of God. It used to be that they didn't use family planning. Now they start using it, and some of the women have not gotten pregnant in 5 or 6 years.
In 1 year, there is a new card registration system and new instruction cards at the Women and Children's Health Center.
It is better than last year. We have a different director who is very cooperative with us. The previous director was Islahi, and he refused to let the Murshidat talk to the men. If the husband came with his wife, he ordered the husband to wait outside. Some of the fathers wanted to go in with their wives to talk about the problem and ask questions. Now the new director allows the men to go in and they can stay with their wives. Now we can talk to the women, and the man is standing nearby listening.
كان من أول يعني في ضغط شوية اليوم يعني بالنسبة للمدير عادي يقول لك الأب يدخل مع زوجته مثلا يتكلم تأمل الإرشاد والأب يكون واقف في الباب.
Another improvement is that malaria has decreased from last year. The municipal authorities sprayed anti-malarial chemicals in apps and in the hospital. Even the markaz was full of mosquitoes, but not now. This director is more cooperative. He talks to us and asks about our problems. He himself supervises the cleaning. He cooperates with us, and we cooperate with him. He is like one of us. He is totally supportive. Frankly, there are many benefits in apps. One of them, for example, is that if you go in any house in apps, you will never find bottled milk. We used to go to the houses in the early morning. Now we can find the women putting bed sheets in the sun. There is no garbage, no dirt. They are cleaning the children. So you feel you have done something and you feel there is improvement. And this year is better than last year, better than when we started. There are many developments. The female primary healthcare worker does more than the male primary healthcare worker. The men can only give injections, vitamins, and immunizations of children. The Murshidat immunize children. We examine pregnant women, give injections, give her vitamins, health training, make home visits, deliveries, and do postnatal checks. Anything there is to do, we do. The role of the male health worker is to give immunizations and injections. There is hard work and cooperation among the girls, and each one gives instruction. They vaccinate the children and give instruction, and the one in the nutrition room shows how to make food.
This is the first time that most of the women have taken on professional public roles. The transition to a new economic status is affecting the way Yemeni women see themselves.
We are not egalitarian. Some girls are educated, then they must stay at home. Some people say that their children should go to school and work outside the home, but others say no. Girls should go to school, then stay at home. There is no equality.
Before the Maternal and Child Health Center opened, most people, especially the most marginal, could not afford to pay the fees that were required for service. In the early 1980s, APS was divided into quarters, reflecting the social, ethnic, and occupational categories of pre-revolution society. North Yemen had overthrown the conservative religious monarchs in 1962, and South Yemen had won independence from the British colonialists in 1967. Both countries had abolished social distinctions based on one's birth and occupation, including slavery. But these divisions have persisted throughout Yemeni society to various degrees, even after North and South Yemen were reunited in 1990. APS is mainly divided into two parts: the market, souk area, where the social outcasts live, and the town, Medina, where most people claim tribal or ex-slave ancestors. The social outcasts and ex-slaves have African origins, which are said to predate the arrival of Islam in Arabia in the 6th century.
Because of social traditions, we did not go into the souk. Here there is a souk. We do not feel superior to them because they are black, or ex-slave, or khdam, menial servants, or anything. All of us are equal. But the problem is that in the souk, everyone is there, and for women, it is considered shameful. They say, "Isn't she embarrassed to go without an escort?" Their understanding is mistaken.
Clients at the Maternal and Child Health Center represent a cross-section of the community. This is a direct result of the Murshidat's outreach into the town, including the social outcast quarter and the neighboring villages. In raising health consciousness, many of the women are also promoting the social integration of their community.
This is the way we brush our teeth. All of us must brush our teeth. For example, I don't say there is any difference between Akhdam, Arab, or a president. All are the same.
Today, the growth in population has caused the town's societal divisions to be less distinct. When they were training you as a Murshidat, were there any differences?
No, there was no difference. They treated us all equally. They respect me, they like me, and if I recommend something, they follow it.
While health care maintenance and education is the Murshidat's primary concern, this interaction is having a far-reaching impact on the society as a whole. For example, one of the Murshidat is going so far as to help women in the market to organize a cooperative cleanup of the roadways surrounding their homes.
I benefited from everything: cleaning my house, organizing my life. My health is good and my children are not sick, praise God. All my children are vaccinated. Fatima from the Murshidat comes to give me instruction and I go to the markaz. Fatima is the one who comes. If I'm pregnant, I go there. They check my blood pressure, my weight, give me vitamins, vaccinations. When I had my baby, they gave me injections and looked after me. I know how to feed my children, clean my house, and now I don't get sick, neither me nor my children. I learned to breastfeed my baby from the Murshidat. I benefited from everything.
Where did you learn to breastfeed?
From the health center.
Each Murshidat combines work at the Maternal and Child Health Center with taking care of her own family, which most often includes children.
If a woman has someone at home to help take care of the children, then she is calm at her work in the center. If she doesn't have someone to watch the children, she is always in a hurry.
The women seek both material and professional support for carrying out their day-to-day responsibilities.
I wish that the administration and Ministry of Health all would be cooperating with us, that they will give us more medicine, cleaning equipment, and order the instruction pictures about breastfeeding, about cleaning. And the most important is equipment. Another video or TV, if one is out of order, then the other will be working. We want a room for childcare. We need everything. The most important is that we need new outreach materials because ours are outdated. We want in-service training. We need it in delivery. We want new information and training, intensive courses in family planning, prenatal and midwifery. Yes, we know about delivery, but information always needs to be renewed, for example, on the different forms of delivery. In the nutrition room, we need a refrigerator. If they bought a refrigerator, it would be better when we explain about vegetables. Managia and I bring one potato from our houses to show the mother how to fix it for her baby. If there is a refrigerator, we can show her how to feed her baby. I wish that all the instruments and equipment that we need in the delivery room could be available. When the foreigners were here, we used to go with them in their car on home visits. We would see if there was anemia, if there was a pregnant woman, a malnourished child, a child with diarrhea. We spent 3 days in the villages and 3 days in the center. The Markaz has become better. I hope that the center will become cleaner, bigger, and better. I would like a hostel for the Murshidat who are on duty 24 hours and have no place to sleep. Now, when the Murshidat sleep outside, the mosquitoes bite them, so every week one of them has malaria.
The women need not only in-service training, but scholarships if they want to continue their basic education and be certified as midwives, nurses, medical technicians, or doctors. This is essential if Yemen is to provide a more comprehensive health service program. Finally, the Murshidat eventually want more responsibility in training, recruitment, and supervision of center activities.
I want them to pay attention to us, to recognize our work, to improve it. No one recognizes the importance of our work. Our monthly reports to the Ministry of Health show that the work is increasing every month. They can make it better and better.
I collaborated with the Murshidat in making this video in order to present the story of their work both inside Yemen and outside of Yemen. The women wanted a video that could be used to train and recruit new Murshidat who are essential to the improvements in Yemen's healthcare and social relations.
In the past, a woman gave birth until she got sick, and then she either died or she lived. It was up to God. God help her.
Did you see many children die?
A lot.
I am going to ask you about the Murshidat in the health center. Have you, your children, your wife benefited from the Murshidat?
I know if my wife gets sick or anything, she goes and they help her. Even if I'm not here, she can go to the hospital.
All of the people, if there are any problems, it's the Markaz. If it's immunization, it's got to be the Markaz. Birth, children with malaria, family planning, it's the Markaz. Problems with pregnancy or any health situation, even if she is sick and not pregnant, she is delivered into our hands, the Murshidat.